Hi everybody, this is Professor Resendiz. I'm here today to show you how to do a priming of your primary and secondary IV bags. It's something students often struggle with, so let's get started. We have our practice normal saline, and we have our primary line, continue flow, and we've got our secondary med and our secondary line. You can see it's secondary on the package, and also because of the hook that comes in the secondary packages. Okay, we also have an alcohol wipe, a sterile cap, and we have our line label. Most intermittent infusions are good for 24 hours. So we'll go ahead and start by opening our primary line. We can throw out our package. And you have a sink or a barrel nearby for you to prime your line into. Okay, and we're gonna open our saline. And we're going to take our cover off our spike, and the most important thing is don't touch that because it does need to remain sterile, okay? And then we're going to push to spike our bag. Some are easier than others. And then I always give the chamber a squeeze on the way over so fluid can come in before air. Okay, so now our line is priming, and we could clamp it to control the flow, but I'm letting mine prime with it wide open right now. And once we get all the air out and the line is fluid filled, we can clamp it. Sometimes there's some air in the line and you do need to loosen the cap or even take it off and let the fluid run more quickly to get the air out of the line, okay? And if you ever want to stop the flow of something real quick, you can just kink the line in half, right, to stop the flow, but we're going to let all the air flow out. And once the air is out, we're going to clamp our line, and we're going to put a sterile cap on our line to keep it nice and sterile. Okay, so now our line is sterile, and I'm just going to put it on the pumps so you can see where we need to plug in our secondary line. So every pump is different. Different facilities have different types of IV pumps, so you'll get used to the pump wherever you work. Okay, so now our primary line is filled with fluid. It's on our pump. I'm actually just going to leave the pump off while we're doing this for now. So this is the port that we need to plug our secondary line into. So next we're going to open our secondary line. I'm actually going to put our saline where it needs to be, which is lower than the bag we want to run into our patient. Okay, so we're going to, again, we're going to make sure we keep this spike sterile. Don't let it touch anything before spiking our bag here. I'm going to go ahead and close the clamp because I want to show you backwards priming. So we're going to hang our secondary line. Remember, piggyback medication, when you jump on someone's back, you're always going to be higher than that person. So piggyback is always going to be higher than your saline. So secondary and primary, whatever we want to run should be highest. So we're going to go ahead and connect our secondary line. So we're going to wipe the port 15 seconds or follow your hospital policy. So after 15 seconds, you're going to take your secondary line here and plug it into your primary line here. So the port is cleaned and now we're plugged in. Okay, so whatever's highest is going to run. So for this moment in time, we want the saline to run because we want it to run backwards and prime this line for us. So I'm going to take this secondary and hold it lower than our primary, and I'm going to open up the chamber, the clamp, and we're going to see this saline is running, and it's running backwards to prime our line. So now our line is primed and the chamber is more than half full, so I'm going to go ahead and clamp the secondary. I like to see what's happening in the chamber, so I'm going to go ahead and tip it upside down, give it a squeeze. So now we can see our chamber half full. So our secondary goes back up higher than our saline because we want our secondary medication to run into the patient. So we'd program our pump, we'd set our primary medication, saline as a flush, and we would set up our secondary medication on the pump. One thing you have to do is just make sure you unclamp your secondary med before you leave the room because you want to make sure it's open to go into your patient. So I hope that helps clear up the backwards priming or back priming for you all. Then you just label your line, put your initials, and put it right around your IV line. So I hope that's helpful, everyone. Have a great day.